So I have changed my network. Probably now you will not find any kind of interruption. So can you hear me properly, everyone?
Yes, Dr. PUUJA.
So Rekha, what I was telling, I was saying that you go hospital every day, right? From your
Yes, ma'am.
from your home to your hospital, you know your way, correct? So that is your fixed format.
Hmm.
Now, what are the challenges which you are going to face during your exam? That they come up with
There's different patients.
different role player, different questions. So that is your challenge which you face in traffic. Sometimes traffic is less, sometimes traffic is more, sometimes there is rain, sometimes there is snow. If somebody is living in that country when they have this privilege of having snow, right? So these are the challenges which you face while going through same route. You are aware of every pole, every light, every shop, right? So that is your fixed format.
I got your point, Dr. PUUJA.
And this is for everyone. My suggestion would be always make a fixed format, how you are going to start, how you are going to end. In between, whatever challenges you are facing, that you have to face. Am I clear, girls?
Yes, Dr. PUUJA.
Okay. So now who wants to try introduction? And Rekha will play your role player. I want volunteers. There is no sense of this session if you do not present here. Only then you can improve, you can brush up, you can, volunteers, please. I will not go ahead if everyone is not going to participate.
Yes, ma'am. Hello, ma'am.
Yes.
I'm Fatma.
Fatima is now going to be a student, and Rekha, you are her role player, introduction and setting agenda.
Okay.
Come on. Yeah, start.
Fatma will start, Doctor.
Yeah, Fatima, start dear.
Yes, ma'am.
Start dear.
Ma'am, it's just a screen for Korean fertility.
It is no. You have to just give your introduction and setting agenda for any subfertility task. How you are going
Okay.
to do that? This is I'm not going to do any task here. Let me clear, girl.
Okay.
But I'm
Okay.
going
Okay.
to cover complete subfertility the way how you are going to handle all the tasks.
Okay. Okay.
So start.
Hello, I'm Dr. Fatma, one of the doctor in the fertility clinic today. May I confirm your name and age, please?
Yes, I'm Sally Sinmit and I'm 35 years old.
How can I call you?
Sally will be fine.
Okay, Sally, I can gather from your GP notes that you as a couple are trying to conceive for a baby from last 2 years, and for which GP has advised some tests, and you are here to discuss the results of the same. Am I right?
Yes, doctor. Actually, we as a couple are trying a lot. They told me everything is fine. We suffered a lot. That why we are not getting pregnant. I'm getting so much upset, doctor. It is affecting my relationship now.
I'm really sorry, Sally. You are going through this. Do you want me to connect a counselor?
Lovely.
Yeah, but what the counselor will going to do for me?
Counselor, talking to a specialist will help you to ease your mind, Sally.
Okay.
Okay, so you can take your partner as well on a counseling. So don't worry, we are based. I will discuss the things with you. And is that okay if we ask you a few more questions and then mutually will make safe and acceptable plan? How this sounds to you?
Yeah, that sounds good.
All right, thank you so much. Ma'am, is that all or?
That is, were you not there when Rekha was presenting this part of task? Were you there, Fatima? Did you hear
No,
her?
ma'am.
Okay.
No.
So, Tavinda, so this is your preparation. I'm starting right away. You were there. What two important lines Fatima missed?
Ma'am, I want to ask you some intimate questions, so please don't mind.
Okay. And what was the other one?
Ma'am, I heard this.
Ma'am, I miss the other concern. Is that all, or do you want to discuss something else?
Confidentiality. Who is this?
Shweta ma'am.
Shweta. So now Fatima is going to be your role player and you are going to be the doctor in fertility, the great doctor in fertility. Start.
Hello, I'm Dr. Shweta, one of the doctors in the fertility clinic today. May I confirm your name and age, please?
Yes, doctor. I'm Claire Brown. I'm 28 years old.
How may I address you?
Claire is fine.
Okay. Claire, I understand from your case note that you're trying for a baby and you're here to discuss about the same. Is that correct?
Yes, doctor.
Mm-hmm. May I know your expectations from today's consultation?
Yes, doctor. It's going to be 3 years. We are trying for a baby, but it's not happening. I don't know what's the matter. Me and my partner, we are healthy. If you advise some test, and I'm here to discuss the results, and I just want to get pregnant, doctor. Please do something.
Surely, Claire, we as a team of doctors are here to help you in the best possible manner. At the onset, I would like to tell you that whatever we are discussing here is totally confidential, and I might ask some questions which might sound intrusive. Is that okay with you?
Mm-hmm. Okay.
Lovely, Shweta. Well done. Very well done. So now, Tavinda, did you understand Fatima?
Yes,
Yes,
ma'am.
ma'am.
Okay. Okay. Anybody else wants to do introduction or
Yes,
should we go ahead?
yes.
I
You?
want anyone else who wants to do this introduction part or should we go ahead? Because 3 volunteers I would be liking for every part of task.
Ma'am, I want to do.
Yeah, Tavinda, now you are a student and Shweta, you are going to play her role player. Be a little bit gentle with her because she's preparing for the very first time.
Okay. Hi, I'm Dr. Tabinda, one of the doctor in the fertility clinic. May I confirm your name and age?
Yeah, I'm Shweta. I'm 32.
How may I address you?
Shweta is fine.
Okay, Shweta, I have gathered from your notes that you are here for the fertility treatment. Is it correct?
Uh, Well, doctor, let me tell you that me and my partner are trying since a long, almost 2.5 years for a baby, and nothing is
Mm-hmm.
working. So I went to my GP, and GP said that he did some test, and he said that I should come and discuss the results with you, and I'm here.
Okay, Shweta, I can understand your worries, but don't worry. We as a team are here to support you. And first of all, I want to tell you that whatever we discuss is purely confidential. And I will ask you some intrusive questions, so please don't mind. Okay?
Fine, doctor.
Tavinda, never say if you don't mind. This is very informal language. Now, again, I want
Mm-hmm.
you to explain here speaking layman language and speaking informal language. These are two different things. You have
Mm-hmm.
to be formal. Layman language doesn't mean that you have to be informal. You can't. At the end of the day, you are specialist, you are consultant, you are doctor.
Mm-hmm.
Can't be informal with patient. Being friendly, being
Mm-hmm.
empathetic, using layman language doesn't mean that you will be informal. Never say if you don't mind. This is these slogans which we use normally when we speak to our friends, our juniors,
Mm-hmm.
right?
Mm-hmm.
Younger ones. So say, pardon me if you find any of my question intrusive or the way Shweta told. Shweta, would you like to repeat this? Just for the
Ma'am,
winner?
what?
That how you are going to signpost for intrusive questions?
Um, क्या बोल-
The way you did.
Okay, so I would be, ma'am, I forgot.
No, just take your time. You're good. I know that. Take your time, 20-30 seconds, and do it. This is how you will be prepared for any kind of challenges during your exam.
Mhm.
Yeah. Start with confidentiality. So you will get a flow.
So, at the onset, I would like to tell you that at the onset, I would like to tell you that no, at the onset, I would like to tell you whatever we are talking is totally confidential, and we might ask you some questions which will be intrusive. Is that okay with you?
Tavinda, are you there?
Yes, ma'am.
So did you understand?
Yes, ma'am. Yes.
Would you like to repeat it?
Okay. Whatever I will discuss with you is would be purely confidential, and I would like you some intrusive question. Is that okay with you?
Fine, doctor.
Okay.
Okay. So, n- okay. So now everybody understood how you are supposed to do introduction and setting agenda in all infertility cases?
Yes, ma'am.
Okay. Now moving further. HOPI and routine information gathering. I have personally noticed while teaching students, they are not able to understand how to start or how to make HOPI in fertility, which is quite understandable. Because in HOPI, see, you said already that I've been planning for so many years, nothing has happened. I have come with the, all the tests. So it's really become difficult to how to make a HOPI. Reason being, HOPI is basically whatever is given in the task. Whatever is given in the task. So whatever is given in the task, she has already explained that I've been trying this and that. So how to start? The best way to start HOPI in any fertility, especially if you are not getting any clue, that is history of togetherness. History of togetherness. Since when you are together, since when you are planning, and were you using any contraception or which contraception were you using? This is how you can start your fertility information gathering. This is going to be a kind of HOPI only. Like if it is a case of say azoospermia, like if it is a case of just say vaginal septum, like if it is a case of you can say unexplained infertility. So this is how you can start. Then the second should be very importantly sexual history. That is so very important, and that's why you signpost in the beginning itself. And third is partner history. Please make a rule of talking or asking about partner in the beginning itself when you're asking partner history. I personally do not like, do you have any medical condition? What about your partner? Do you have any surgery? What about your partner? This doesn't look, I would say, this doesn't look, systematic. So, history of togetherness, sexual history, and partner's history, right? So, who is going to be volunteer for this? Catherine, can you unmute yourself? Catherine, are you there? Dima, any new volunteer? Otherwise, I have to pick the old ones. Can you hear me, everyone?
Yes, ma'am.
So
Yes,
please
ma'am.
Ma'am, we can hear
respond.
you.
Please respond, because this is like I'm talking to, like I'm just, talking to wall or something like that. I don't like these kind of live sessions when there is no communication. We will not call it communication until it's both ways.
Ma'am, I can do if nobody is doing.
Yes, so Fatima is the one volunteer. I want three.
Ma'am, may I do next?
So Rekha. And who is the third one? No one knew. Akansha, do you want to try this? Unless you make mistakes, you will not improve. For improvement, it is very important to try and making mistakes. Part 3 is not about listening, Dr. Pooja, or listening to your colleagues or your fellow batchmates or your fellow contestants. Part 3 is about only speaking and talking and putting your words forward. So there is no sense if you are just listening me. Any new volunteer? I really want new volunteer.
Ma'am, what I have to do?
Okay, I'll just explain it. But do you want to volunteer?
Yes, ma'am.
Lovely. Anam, Amna, Catherine, Dr. JM, Kiran, unmute yourself, darling. You have to face me. Kiran, Shweta,
Yes, ma'am.
just message Kiran that she has to unmute. She has to participate. Message her.
Okay, ma'am.
Unless she has left session because of my fear. Okay.
She is not in the session, ma'am.
She was there. I think she has left. No, there's some Kiran. Isn't it the same one? I don't know. There's one Kiran. Maybe somebody else. Okay, no issues. Okay, so first I'll give chance to Shweta, right? So you can listen to her. After that, Akansha, you have to follow that. And then Fatima. Okay?
Okay, ma'am.
Huh?
Mm.
Rekha, are you there?
Yes, ma'am.
Just play role player for all of three and be very difficult for Shweta and be very difficult for Fatima and be very difficult for third. No, be gentle with third one, Akansha. Okay?
I will try.
Okay. Start.
Ma'am, HOPI, na?
Yes.
Okay. So since how long you and your partner are together?
For the last 3 years.
And you're trying since how long?
For the last 2 years.
Okay. And were you practicing any kind of contraception?
Doctor, we are trying for the pregnancy and you are saying contraception. What rubbish is this?
Well, not at the moment, but previously, were you using any kind of contraception?
No, doctor. Previously, the first year of the marriage we tried. Then afterwards, no.
Okay. Thank you for letting me know all this. Do you or your partner consider yourself as a happy couple?
Yes, of course, doctor.
Okay. Can I ask few questions regarding your partner?
Yes, doctor, you can.
Okay. May I know his name and age?
Yeah, he is John and he is 35 years old.
Okay. Otherwise, he's medically fit and healthy?
Yeah. Doctor, we are both are fit and fine, but we are not getting pregnant. So I'm not getting pregnant. The issue is that everyone is just asking questions, and no one is giving the solution. I'm just fed up of this.
Well, I'm really sorry that you are very upset because of all this. I know we respect your desire of motherhood. We all are here to help you in the best possible manners. These questions, since we are meeting for the first time, it's really important that we know everything about you.
Okay.
Is it okay? Ma'am, starting to itna hi hai?
Sexual history. Speak in English. Shweta, we are
Sorry.
recording it. It will be on
Yes, sorry.
Yeah.
So can I ask you a few more intrusive questions?
Yes, you can.
Okay, a number of times you have sex with a partner in a week.
2 to 3 times.
Okay.
Sometimes 4
Any
times.
All right. And any discomfort, any problems related to pain, erection, ejaculation?
No, doctor, you are asking so many questions together. Yeah, everything is fine.
Okay. All right. And have you or your partner ever had any sexually shared infections?
No, doctor, it's the only partner, never.
Okay. Thank you for letting me know all this.
Okay, Shweta, very well done. Rekha was really a difficult role player. Probably some of the role player may sound this way.
Oh, ma'am, I thought she will bang me now.
Ma'am, I tried, but it's very difficult for me.
Shweta, but the best part is that you were not fumbling. You were appearing quite confident, doctor, which is very important because you may face these kind of doctors, no? Sorry, role players. You do face these kind. you might be facing these kind of or finding these kind of patient in your personal clinic as well. Right? So the best part is that you should know how to handle this, which you have done perfectly, nicely, very well done, Rekha, and very well done, Shweta. Only thing, even she was trying to distract you. There are certain questions which you are not supposed to miss. Like in partner history, though she was saying we are all fit and fine, the one very important question which you didn't ask.
Medicines.
No.
Treatment we have already taken, and
No.
any investigations done so far.
No.
Fathered.
Any-
Fathered.
Yes. Yes. Did he father a child before? That is a question that is very important. So even if she's saying I'm fit and fine, everything is fine, this is the question. In spite of that, you have to ask. Okay. Same in the sexual history when she was saying I'm absolutely fine, this and that. There is no problem in sexual activity, then you can skip that part of like any difficulty in sexual activity. Otherwise, what should be the sequence of asking, Shweta?
Any pain?
No. First, how many times you try in a week? Second is,
Number of times.
and
Any
second
problem
is,
related to penetration?
what is the
Erection?
first? What is the first? First is erection.
Penetration.
No,
Erection, ejaculation, and penetration.
no. First is erection, then penetration, then ejaculation. You find any difficulty in sexual activity like erection, penetration, and ejaculation, because that can be very relevant in case of diabetes. In case
Okay,
of
ma'am.
even vaginal septum as well, probably he has no problem in erection, but he find problem in penetration because he is not able to penetrate after a certain point. And sexually shared infection, but OVS is a very, very important question because it can cause blockage in like a female partner, or it can block vasa deferens. So there will be problem in that particular portal which takes semen from testes to outside. Right? Even if she is angry, there are certain questions which you are not supposed to miss. If she is saying no, we have no problem in sexual activity, then you can skip this question. Okay, so this much you are supposed to ask. Now, why she pounced back on you on the question of contraception? Because your question was not to the point. What should be your question actually? Were you using any contraception before this or before trying for pregnancy? Then she should have not been that way. Probably that was the triggering point for her. That I have come, I'm just struggling, and you're asking which contraception are you using? You getting my point, Shweta? Rekha, am I right?
That's why I do this. Yeah.
Yeah, because she got triggered with this question. Sometimes you get triggered with certain question, and after that you lose your mood, and you are not now you just in bad mood, and you are going to give only, difficult questions or difficult answer. It happens with us in normal life as well, no? A small triggering point can change the complete scenario. So be very careful while asking the questions. Fatima?
Yes, ma'am.
Now role player will be again Rekha. Rekha, come with the different questions. You should not be prepared.
Okay, ma'am.
Just a minute, there is one call. Just a minute. Hello, hi Shweta. Aarti, Aarti, okay. I'll definitely can you give me just 1 hour? Just 1 hour. I'll definitely get back to you. Okay? Okay. Yes, come on.
So, what is can she tell me her name so I can communicate?
Just take any name.
Okay.
Call her
Okay.
Rekha, no problem.
Okay.
Rekha, you have problem by calling Rekha?
Hello, ma'am.
No.
Yeah.
Okay.
So, Rekha, since how long you and your partner are together?
Yeah, for the last 3 years.
Okay. And since how long you are trying for baby?
Yes, doctor. Actually, some investigations were done, and they diagnosed me the condition of polycystic ovarian syndrome. So, We are trying for the baby since a long time, but I don't know, is it a reason for not getting pregnant? I'm very much worried.
Your concern is very valid. I'm coming to your concern in a bit. Is that okay if we ask you a few more questions quickly? And then I will discuss.
Yes, you can, doctor.
Okay. So you, Rekha, you and your partner have been parents before?
No, doctor, never.
Mm-hmm. So few intrusive questions regarding your sexual activity. Do you know the fertile period?
Yeah, doctor, we already know about that, but my cycles are very irregular.
Mm-hmm.
I
Okay.
cannot comment on that.
All right. And how many times in a week you are doing intercourse?
We are doing, doctor, frequently. We are not counting that.
Mm-hmm. Any concern regarding intercourse, like bleeding or pain?
No, doctor.
And your periods are regular? Can you tell me more about your periods?
Yeah, doctor, my periods are always irregular since my first period. It's not a fixed time when they will come. So I have to take the tablets for the periods to come.
Okay,
That's
so
it.
since
That's it, Fatima. I just wanted that whenever you start, there's a history of togetherness first, then sexual history and partner history.
yeah,
Okay.
okay. So
This
few
is your
questions.
HOPI. This is your HOPI.
Okay, so few questions regarding your partner. May I know his age
Yeah, he's 35.
and what does he do? Profession?
He's a taxi driver.
Okay, so any apart from any medical or surgical
No,
problem,
no. Make it shorter, Fatima. Make it shorter. Make it
otherwise he's medically fit and well.
Yeah, he is fit and well.
So any concern regarding intercourse, Rekha, in the form of erection, penetration, and ejaculation?
No, doctor, no such issues, but he is blaming me that I'm the responsible for not having the baby. I think it's my fault.
Rekha, it's not your fault, and don't worry, we are here to help and support you. So there are many ways, and you can be definitely there are many ways we will discuss with you, and you will be a mother.
Okay.
Okay,
So
Fatima, never
yeah.
say that you will be a mother. You cannot give 100% guarantee to anyone. We
Okay,
are
ma'am.
all there to support you. As a team, we'll try our best to make you parents.
Okay.
Fatima,
Yes, ma'am.
sorry, Rekha. Now Fatima will be a role player and I will present the case.
Yes, I will role player or I will be the
Student,
candidate.
will be student. Fatima is going to be your role player.
Okay. So some of my questions will be intrusive, but it will be confidential among us. May I know that since how long you are with your partner?
Doctor, we are together from last 5 years.
Mm-hmm. May I know about any problems you are facing during the sexual activity?
Like what?
Any problem, any discomfort with any erection and ejaculation problem?
No.
Mm-hmm. Any treatment and have you tried so far? Any investigations were done?
Yeah, doctor, GP did some investigations, and
Mhm.
I'm here to discuss the results. You can see from my notes.
Okay, we will discuss in a moment. So, may I know about your partner? Is he generally fit and well?
Yes, he is.
Mm-hmm. And what is his age and what kind of job he is doing?
Yeah, he is 37 years, and
Hmm.
he's teacher doctor.
Okay. So, what else, ma'am? This is up to this point.
Okay, okay. I'll just brief.
May I know that ever you and your partner have any child before?
Yes,
Mm,
yes.
yes, my partner has he has a son. He's 6 years old. I don't have any.
Okay. So his is a second marriage.
Never
Doctor, we are
ask,
partners.
never
We
say,
are
Rekha,
partners. He's
never
not
say,
my husband.
Rekha, Fatima, stop. Rekha, never
Okay, ma'am.
ask this question. What if they
Okay.
are living together?
Okay.
Very
Okay.
derogatory question. Never ask this question. This question is
Okay.
only applicable in case of same-sex couple. Are you in civil
Okay.
relationship or married?
Okay. Okay, ma'am.
Okay. So it was good, very good. Rekha, now I'm going to summarize first How you are going to start HOPI in certain cases? First, may I know since when you are together, since when you are planning pregnancy, were you using any contraception before this? Have you been pregnant before? Did your partner been father a child before? This should be your HOPI first. Second, some intrusive question: how frequently you try for pregnancy in a week? Any sexually shared infection you have been treated or diagnosed, you or your partner? Any problem in sexual difficulty like erection, penetration, ejaculation? May I know a little bit about your partner? Yeah. May I know his age and weight to height ratio? Okay. Generally, he's fit and fine. Any surgery or trauma on his tummy or down below or groin area, you can say specifically when it is male. May I know his profession? That's it. Try to make short sentences. There are certain check box which are given to examiner, which they have to tick. Even if you say that particular topic or that particular this checkbox in 3-4 words or 2 sentences, it's not going to give you extra like double tick. No, it is going to be single tick only. So if you ask about any difficulty in sexual activity, if you ask in 3 lines, or if you ask like very precisely any problem in sexual activity like erection, penetration, ejaculation, that is going to give you tick mark. So try to make your sentences as short as possible, as crisp as possible. Right? Because you have to take only ticks in all the check boxes, which you are going to get with 3-4 words properly presented, which you are going to get with 3-4 lines properly presented. So what should be your choice, Rekha, Fatima, Shweta, whoever has presented this HOPI? What should be your choice?
Your choice. Your sentences are good.
Short sentences. Short sentences.
Yes, ma'am.
They are not going to judge there for your grammar. Though grammatically you should be definitely correct. You should be correct. There should not be grammatical mistake. You are not supposed to use, heavy sentences, heavy vocabulary. No. Make it very short, simple. Am I clear for HOPI, girls?
Yes, ma'am.
Any question, any query?
Ma'am, for partner, you asked that what is his age? We should ask profession. Generally, he's fit and well. Any surgery or trauma down below?
And BMI.
Okay.
Smoking and alcohol, you will ask together when you will going to ask like, do you or your partner smoke? Do you, your partners take alcohol? Pardon me to ask. Any of you take drugs for fun? This way. Clear?
Okay, ma'am.
There's one more thing. Some of students. Sorry. Okay, someone said this thing that my partner is blaming me. It is Rekha? It was you?
Yes.
In a role player, I was saying.
Okay, so Fatima, you were a student at that point of time, right?
Yeah.
So you handle it nicely, but you can be more precise and more crisp. So when your role player is saying that my partner is blaming me, that is the problem is in me, so I can't get pregnant. So who is going to try reply for this? Any two volunteer. If role player is coming up with these kind of statements, how you are going to handle that? I want crisp, short answer. Take your 30 seconds. I'm waiting. Then raise your hands and give me answer. It should be in 1 or 2 sentences at the max, because it is going to cover your patient safety and communication both. And of course, applied clinical knowledge. Applied clinical knowledge and patient safety go together. So, 30 seconds up. Who wants to reply? Manupriya, would you like to reply? You have recently joined. If your role player is saying my partner is blaming me for not getting pregnant and I'm so depressed.
Yes, ma'am.
So how would you reply this?
So we can say that please don't think this way. We need to do run some investigation on you as well as on your partner, to reach to a diagnosis, to reach to a yes, to reach to a diagnosis or to confirm the same.
Okay. Other than that, are you not going to offer her any kind of support because she has been blamed for something? Probably she is not responsible for that.
If you want, we can arrange an appointment with the psychosexual counselor,
Lovely.
where
Lovely.
you and
Lovely. Now you
Well,
got
you-
that tick in your checkbox that you have offered them psychosexual counseling as a couple. Fatima, this should be
Yes,
your
ma'am.
reply. This should be your reply. Rather than, because now because your Rekha was asking which kind of counseling, you have to be very precise. That spatial counseling, we call it as psychosexual counseling. You can come as a couple. You said everything, then later on you said you can bring your partner. Partner has to be there because the problem with partner's thought process, no? Are you getting me, Fatima?
Yes, ma'am.
Yeah. Okay. So now Manupriya will be your role player for the same sentence, and Fatima, you're going to reply. Manupriya, start.
Yes, ma'am. Doctor, my husband thinks that problem is with me. Is it so? I'm really getting depressed with the same statement, listening again and again. Can you please help me with this?
I'm really sorry, Claire, you are going through this difficult time. But we, as a team of the experts, are here to help and support you. Claire, I can refer you for the psychosexual counselor, and you can bring your partner as well. So, talking to the specialist will definitely ease your mind. How this sounds to you?
Lovely. And one more thing, because she's clearly asking whether she has some problems, so how you are going to address that, Fatima? Short and crisp sentence.
Uh, so, we will. Ma'am, what should I say? Like,
I'm asking you. Who wants to reply this? Then psychosexual counseling, what should be the other statement which you have to give? And that has to be, see, you have to counsel, you have to give, you have to have empathetic approach, and you have to
yes,
have
ma'am.
scientific approach as well.
Yes.
So
So we will run the investigations, and we will check.
okay.
So we will check you and your
Yeah,
partner as well.
more refined statement, more refined statement, more refined. Who wants to give more refined statement?
Ma'am,
Yeah. Anybody else? No. See, this is learning session, no?
yes,
So it's
ma'am.
not- yeah. So why so like with this thing? It's okay. It's okay.
Dr. Rekha, Dr. Shweta.
There are many girls. Akansha, Amna, Anam, Catherine.
And we can say like in this way that first of all, we will say that please don't think in this way, and we sorry, don't think in this way. You and your partner will be referred for the psychosexual counselor for the to overcome this situation, and at the same time we will investigate both of you, so to find out the reason.
Okay.
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 Okay, I don't.
I'll just give you certain lines if you find it's okay. Okay, then first, I understand the difficult situation you are going through. We are all there to support you. We are definitely going to investigate and evaluate the reason of not getting pregnant. Meanwhile, if you want, we can put you in touch with the special counselor. We call it as psychosexual counselor. You can come and see as a couple. That is going to ease out your stress. How does it sound, Rekha?
Yeah, that sounds good, doctor.
Repeat.
I understand your concerns with this difficult time for you. We as a team are here to help and support you, and we definitely investigate both of you. Meanwhile, you and your partner will be referred for the psychosexual counselor to overcome this situation.
Lovely. Fatima,
Yes.
repeat.
Okay. I understand. I'm sorry you are going through this difficult time. So we as a team of experts are here to help and support you, Claire. Definitely, we are going to investigate you, both of you, and to find the cause, like why you as a couple are not getting pregnant.
Make
But
it
meanwhile,
shorter, Fatima. Make it shorter. You can't waste 1 minute on that. You have to finish in 30, 40 seconds. Again, repeat.
I'm sorry, you are going through this difficult time.
Never
We
say
as a
sorry. No. One thing I would like to mention here, the word
Mhm.
sorry is not applicable for any of the doctor until unless you have done something wrong. Something
ma'am.
wrong means you have performed any surgery and then she's going through something like that, right? In that case, you can say sorry. Other than that, sorry is not an empathetic word. Simply say, I understand. Apology you are going to say for any difficult situation, like if she had miscarriage, iud, ectopic, etc., or some like that reversal, she is angry because she was not informed on time, then you can say my apologies. Sorry is not the right word.
Okay,
Even
ma'am.
if something post operative complication she has come with, you will say my apologies. Stop saying sorry. Stop saying
Okay, ma'am.
sorry to your patients even in your clinic. That puts you in that witness box that you have done something wrong. Why you are saying sorry? You are feeling for her, but it doesn't mean that why you are sorry for her. If she is not able to conceive, why you are sorry for that? Okay? Never say sorry, Fatima.
Yes.
Start again.
Okay, ma'am. I understand you are going through this difficult time, but we as a team of the doctors are here to help and support you. Definitely, we are going to investigate you to find the cause. Meanwhile, is that okay if I connect you to the psychosexual counselor? So you can bring your partner as well. So talking to the specialist will ease your mind. How this sounds to you?
Perfect. Okay, so Amna has asked one question. Ma'am, patient was diagnosed with PCOD and partner blaming. So even we will offer psychosexual counseling. Counseling is offered for any kind of resolution. Resolution in a couple they have facing in their communication, in their relation. Reason can be anything. Even a patient is coming with HIV and now partner is blaming because of you I got HIV. Even then you need to offer counseling. Counseling is what? What do you mean by counseling? Counseling means making you aware about the facts. Am I clear, Amna? Okay. So basically, counseling means giving answers to your all the tangles in your mind which you are not able to detangle. So counseling is marriage counseling. Like couples go for marriage counseling. No, they are aware of marriage problems. They are aware of what is marriage all about. Still, they go for counseling. So counseling is anyways is something which is needed when somebody is finding any problem in coping up with their life, whether single, whether married, whether studies. Like now we have study counselors as well, professional counselors as well. No, okay. Everyone clear?
Yes, ma'am.
Yes, ma'am.
Okay, so am I clear so far?
Yes.
Yes, ma'am.
Yes, ma'am.
Okay, so now next, so always divide your information gathering in two parts. One is the HOPI, and second is normal information gathering. Now, quickly we'll discuss what should be the important point in HOPI and different tasks. What if it is a case of diabetes mellitus? What are the important questions which you are going to ask? If HbA1c is given there and you're not sure whether he is diabetic or not, like he already aware of the fact that he is diabetic, or it was the first time HbA1c came high, if it is not given in your task. So what are the important questions in HOPI pertaining to DM you are going to ask? Two volunteers for this.
Ma'am, me.
Me, ma'am.
It's only Fatima and Rekha. The rest all are just not listening to me and they're not liking my voice. Manikam,
No,
see?
ma'am. Your voice is so
Manikam.
soothing.
Manikam, see, nobody is liking. They don't want to talk to me.
Ma'am, see, still after clearing the exam, the people are joining you. How much they like your voice.
Manikam is a sweetheart. Manikam is a
Yeah,
sweetheart.
she's very sweet person.
My moral booster, frankly speaking. The way she messaged me, it's really so much like, I can't tell you in words. I'm thankful for that, Manikam. I will be
Thank
always
you.
grateful for that.
Thank you, ma'am. Thank you for permitting me to attend, ma'am. Some people they push me out of the meeting, ma'am. And I have sent the link to so many people, ma'am, so that they will attend your meeting. Thank you,
Thank you
ma'am.
so much. Thank you so much, Manikam. Thank you.
Thank
So,
you.
who wants to say now? Come on, you start saying or you start writing. What are the important questions which you are going to ask if it is a case of DM in HOPI? Just 2 or 3 words or sentences, not more than that. Start typing, girls. What
Okay,
should
ma'am.
yeah
In the chat. Okay.
yeah if you chat, because for everyone would be able to, because some might be
Okay.
feeling shy in speaking, so better if you can write, because I have to make you aware of most of the time, because it's already 7:30, been one hour. Okay, so yeah, lovely, very good, very good. Other girls, is family history of diabetes, thirsty, fatigue, urgency, frequency, do you feel fatigue or lack of energy? Very good, Fatima.
And one more question, ma'am.
Hmm.
This is one and one more question. I'm typing.
This is enough.
Okay. Okay. Otherwise, we can ask like polyuria. Do you need to go to the
Just to
pass
any 2 question. Off
difficulty?
late, did you notice excessive thirst or excessive peeing?
Yes.
I'm not supposed to ask. If you want to ask diabetic questions, so there are 100 questions. So you have to be precise. Did you off late notice any kind of excessive thirst or excessive peeing? If he is already aware of the fact, yes, I know I have this, doctor, because I'm diabetic, your problem sorted. If she says, yes, I don't know, Shakila, this is about azoospermia. So it is like, this is not applicable. But otherwise, definitely, if it is like female patient, recurrent vaginal discharge or recurrent vaginal infection rather than discharge, infection can be a cause, can be an implication of diabetes. So, am I clear? Excessive thirst, excessive peeing, or fatigue, these 3 questions you can ask. Retrograde ejaculation, retrograde ejaculation, which condition you find retrograde ejaculation? Okay. Roshna, do not ask any question which create further confusion, right? Simply ask Roshna, excessive thirst, excessive peeing, or fatigue. That is all. Okay?
Okay, ma'am.
Okay. So now another question. If it is a case of vaginal septum, okay. Now we should start with vaginal septum only. So if it is a case of vaginal septum, and the scenario is that you are performing her scan, and after 2 centimeter introducing your this thing, a probe, patient started screaming and she asked you to stop. You stop the scan then and there. Now you are meeting with her in your chamber. What should be your HOPI? This you have to speak, because here you have to like speak a few lines. Manupriya raised her hand. Yeah, Manupriya.
So ma'am, we can ask her, do you feel pain at the
No,
time
no,
of
no, 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 no,
entering?
no, no, no. Present it the way that you are presenting case.
Okay. From the starting, may I?
I'll be your role player. Go ahead.
Okay. So hello, I'm one of the
No, no,
doctors
no,
in
no,
the
no, no, no.
fertility.
Introduction being done. You have already done her, scan. So how you are going to start in this case? You have already done her scan. She probably knows you. You probably know her. So what should be your introduction?
So I understand, Clara, that you had difficulty during while I was doing the ultrasound. So can I ask some questions?
Your
Can I
voice
ask
is
some questions?
echoing. Are you on speaker?
Yes, ma'am.
Manupriya, yeah, please, if you can come directly because it is echoing.
Okay, ma'am.
Just-
Hello.
Hmm.
Is it okay, ma'am, now?
Perfect.
So, yes. So, can I, now, Clara, I understand that you had some difficulty. Ma'am, 1 minute. Ma'am, 1 minute, sorry, just 1 minute. So, Clara, can I ask some, so Clara, I understand that you had difficulty while I was doing the ultrasound. So, is it okay? Can I ask some personal questions
I
that
will
may be
not
intrusive?
reply one single of your questions in that way, Manupriya. She was having pain. What should be your first question?
Okay.
Hi,
Offer
Manupriya.
a pain
Hi,
relief first.
Manupriya. How are you feeling now? I'm Dr. Arora, who was performing your scan. Yes, doctor, I can remember that, or I know you, yeah, or I know that. So, are you comfortable? Still, you have pain? You want some pain relief? This should be your first question,
Okay.
Manupriya.
Yes, yes, yes. I thought, yes, ma'am. Okay. Yes.
Yeah. So, how you are going to start? So, this
Uh,
is a very tricky situation, but this is an exam scenario. This was an exam scenario in my exam where I have performed and now she screamed. Now I'm meeting her in my chamber. So she knows me, I know her. So how you are going to start this? So how I'm going to start? How Manipriya, how you feeling now? Are you comfortable talking to me? Yeah, I'm
yes,
Aruna
ma'am.
was performing, Dr. Ro was performing your scan. Yes, yes, doctor, I remember. So are you comfortable talking? You want any pain relief? And
Painkiller.
now Fatima, now
Yes, ma'am.
you will say sorry because you have done something which unknowingly but created some problem for her or discomfort
Okay.
for her. Now I am sorry that during this ultrasound you had that pain. Now you have to say sorry because now you have done something unknowingly. It was not your intention. Even though she had some problem or discomfort or pain. Right? Now you understood when you're
Yes,
supposed to
ma'am.
say sorry or when you're not supposed to say sorry?
Yes, ma'am.
Okay, Manupriya, go ahead.
Yes. So, and so can I ask you further questions? It may be intrusive,
No,
but
no,
it
no.
will help me
Start,
in further.
start, start. You are
Okay,
meeting
fine.
her in chamber now.
Okay. Hi, I'm Dr. Manupriya. I did your scan, and I'm sorry that you had pain while I was performing the ultrasound. How are you feeling right now?
I'm better, doctor, but at that time it was so painful. I don't know why this has happened to me, but it is what I'm facing while having intercourse. Like after some time, when the John is inside, I'm not able to tolerate that. That's my problem.
I understand, Clara, because you are going through a difficult situation. We are here to help you and support you. And are you okay to continue the consultation right now?
Yeah, yeah, I'm absolutely fine, doctor.
Okay. So, Clara, can I ask some intrusive question? It will help me in further management.
Don't say intrusive questions. Here you're setting
No
agenda.
questions.
So here you're going to say, I
Okay.
would like to ask few questions to know more about you. Will help us making a safe plan for you. Can I go ahead? Here you are
Okay.
setting agenda, okay? Then you are going to talk about confidentiality and the signposting for intrusive question. Now start Manupriya from the beginning.
Oh,
And Fatima, you are going to play her role player. And I don't want any single mistake now, Manupriya.
okay. So, hello, I'm Dr. Manpriya, one of the doctors who did your scan. So, may I call you Sarah?
Yes, doctor.
Okay, Sarah, how are you feeling right now?
Doctor, I'm not feeling comfortable. It's too painful. Please, can you help me regarding something?
Okay, sure, Sarah. I'm sorry to hear that. Do you want some painkiller?
Yes, of course.
Okay, so do you have any allergy?
No.
Okay, so Sarah, I'll ask my nurse to give it to you to immediately. And okay, so
Okay.
how are you feeling right now, Sarah? Is it okay if I
Better.
continue the consultation?
Yeah, doctor, better. You can continue.
Okay. Sarah, I understand that you're going through a difficult situation. We are here to help you and support you. But is it okay if I ask you certain questions to know you better, and then we will devise a mutually agreed shared management plan?
Lovely. Lovely. Lovely.
Okay.
Lovely. Well done.
Okay.
Very well done. That's it. Well done.
Okay, ma'am. Thank you.
Who else wants to try this station? This is a very important task. It comes quite frequently. Same scenario they repeat.
Ma'am, may I try? Can I try?
So now I'm going to continue my session with Manupriya, Fatima, and Rekha. Okay? Okay?
Yes, ma'am. We are
Huh?
lucky to have you.
Roshna? Roshna?
Yes, ma'am.
Unmute yourself. Now you're going to present this task, and Manupriya is going to be your role player. Okay?
Okay.
Yeah.
Okay.
Start. Start. You have performed her scan and she is in pain. Now you're meeting her in your chamber.
Hi, I'm Roshna. I am the doctor who performed your scan. How do you feel now, Manupriya?
Doctor, it was very painful. I must say that it is the same situation which I'm facing in my personal life as well. But right now, I'm not feeling that great. It was a difficult time for me. I've had severe pain, doctor.
Uh, I'm sorry to hear that. You want me to give you painkiller?
Yes, it should help.
Okay. Are you comfortable now?
Yes, doctor, yes.
Okay. So one important patient safety point you missed. What was that, Roshna?
Yeah, ma'am. Yeah,
Allergies.
allergy I did not rule out.
Yes, yes. So these are the small tiny points which you miss, then later on everybody thinks that I have done the task so why nicely, so why I couldn't clear the exam. These are the small points which, in spite of your 100% efforts, somehow stop you in clearing exam. So be very, very, very open-minded whenever you're presenting tasks. Roshna, keep your mind, your all
Yes.
nerves, all senses open, free. Okay? This is very
Yes.
important point. You should keep yourself as free as possible. So you will not, you will think like, 360 direction. In a circle, you will be thinking, okay, this. And you have to tune your brain this way. Which you do normally in your clinics. I really don't understand. This is the thing which you do normally in your clinic on daily basis. You have been doing for so many years. Why under the pressure of exam you forgot you forget tiny things which you will never forget in your clinic? Roshna, am I wrong?
No, ma'am, you are right.
In your emergency, if you give any
Yeah,
injection,
we know it, but sometimes under pressure,
yes,
maybe we forget
yes. So
little
for
things.
that you have to keep your all
Yes.
senses free. Eye, nose, ear, every senses has to be free and open. Only then you are not going to miss anything. At least as of now, there is no pressure of exams. This is just a session where we are discussing, we are trying to improve ourselves. So at least do not take pressure here. Here, nobody is going to give you mask. Okay? Okay.
Ma'am, one question, ma'am.
Yeah, sure.
Actually, I have a confusion, right? Like BMI is given and some of the details are given in questions.
Hmm.
So should we ask the details again and again,
No.
or
Then
what,
you
or
can say
be quiet
different.
about that?
Then you can say different one. So your partner is John, right? Yeah. And his weight to height ratio is 39, right? Did he find it? Does he find this any concern of any concern? This way you can address, because if he has BMI 39, 40, so that's a concern. So you're not going to ask you, okay, what is his BMI? Okay, so your partner is John, right? Yes. His weight to height ratio is 39. Does he find this any kind of concern with this weight to height ratio or BMI? If he says yes, if she says yes, no, then you'll address that way. If she says no, then do not address that then and there. Then address that in second part of the task. But if she says that, Yes, he is really concerned about his weight and somehow he's not able to lose weight. Then how you are going to reply this?
To me, ma'am.
Yes, yes.
We'll ask, does he show these concerns to the GP? Does he is availing any dietitian or exercise specialist ad- advice?
No, how will you say it? Say it properly.
Okay, so Mary, may I know the weight and height ratio of your partner?
Yeah, it's 39, doctor. It is given in task. It is given in task. Just reply this question the way you have questioned me. That what if it is given in the task? Then what should be your question?
Okay, so Mary, I can see that the weight to height ratio of your partner is 39. Am I correct?
Yes,
Uh,
doctor.
okay, so does he tried to lose a few
No,
pounds?
no, why he will lose the weight? He is absolutely fine, doctor. He is not fat. Patient will, role player will come with this reaction.
Okay.
Never be derogatory. Probably he doesn't find like if I'm 100 kg, I'm okay with it.
Yeah.
So what should be your question?
May I, ma'am?
Yes.
So, Sarah, I understand that John's weight to height ratio is 35. Does he feel concerned about his weight to height ratio?
Yes, doctor. He's trying a lot, but he's not able to reduce his weight. What
Uh,
we can do for this?
I understand, Sarah. So now, from now, we will arrange with his care will be taken by multiple healthcare
No,
professionals,
no, no, no.
which
Here,
is
no, Manupriya. It's Manupriya, right?
so. Yes, 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 ma'am.
Manupriya, here you are in
So,
information gathering. So you
okay,
have to address only his weight. So
yes.
what all?
So we will
Yeah.
obviously. So we will try to make an arrangement with the physical trainer as well as dietitian who will help
Lovely.
him to
That's
keep
it.
him.
That's it. That's it. You got the tick mark. That's it.
Okay.
So
So,
who's
ma'am, again, can you please summarize? What should we say?
yeah, Manupriya?
So I mean since the start from the starting one.
Yes.
Okay. So Sarah, I understand that John's BMI is 35. Does he consider? Is he concerned about his weight to height ratio?
Yes, doctor. He is concerned and he is trying to lose, but it's not happening.
Sure, we are here to help him. So now I will arrange an appointment with the physical trainer as well as dietitian who will help him to make a customized chart and customized exercise plan and diet chart for him. Is it
Lovely.
okay for you?
Lovely.
Okay.
Everybody understood? Never, never. It's not only for John, it's for Sarah as well. If Sarah's weight is on higher side, and you're asking your like her BMI, may I know your weight to height ratio? If she says 42, never say that you need to lose weight or it's a concern. Never. You ask, do you find it a concern? If she says yes, then address then and there. If she says no, I'm fine, I don't find it a concern, then just finish it there. Do not drag it. Once you reach in second part of the task and when you talk about lifestyle changes, then how will you say? Then how will you address this point without making any derogatory comment? Who wants to try this?
Ma'am, can I?
Who is
May
this?
I?
Who is this?
Ma'am, Dr.
Rekha.
Kavinder.
Okay, Rekha.
Tabinda, okay, na? Dr. Tabinda can try first.
Yeah, Rekha, try.
It's ma'am, BMI is 42 and she does not have a concerns about it. This
Yes.
is a scenario.
Yes. So now in second part, in lifestyle modification, how you are going to address this?
Mm-hmm. So may I know your weight to height ratio?
No. It's all done.
Mm.
Now you
Okay.
in second part of the task. Now how you are going to bring that point again without making feel her bad?
Mm-hmm. I'm not trying to be judgmental, but having the higher weight to height ratio has some concerns. Whatever the ma'am, if the fertility is having, maybe then I will
Whatever
interact.
you just make scenario. I just want
Okay.
answer of this question.
Okay. Okay, I'm not trying to be judgmental, but having higher weight to height ratio may be the reason of not maybe the reason of difficulty in conceiving.
This is borderline for me. I want
Okay.
more refined answer.
May I, ma'am?
Because once you say, I'm not trying to be judgmental, you are judgmental. So
Okay.
do not mind it. It means you are going to say something. You say your friends, no?
Ma'am, so we can say in this way that I'm not trying to be judgmental, but evidence suggests BMI of less than 25. We can say.
Never say that
Okay.
Ma'am, we can say
judgmental
that
line. Because
I understand that.
once you say, Rekha, that please do not mind,
Yes.
you're not looking good. So you are yourself suggesting that like there is something which you can mind about.
So, okay, ma'am. So how we can say that?
Never say this
So, ma'am,
judgmental
can we
line.
say?
Yeah.
I understand that John's BMI is slightly on the higher side. Does he consider it as a
No, rejected. ये तो हो गया ना, Manupriya, this we have done. Now second part of
it
it
is on the higher side.
now
I consider it.
No. She said no, John is not concerned about his weight. He thinks that he's fit and fine. Now you are in second part of the task, but you have to address this because having BMI 40, 42 is definitely on the higher side. So how you are going to manage this in second part of the task without making any derogatory comment?
So, Sarat, the evidence suggests that losing couple of pounds will help in fertility as well as reduce the long-term health complication. So,
Yes.
how does it sound to you?
Yes, much better. But I want more refined.
Ma'am, like we can say that, Sarah, in the medicine, we have a healthy BMI ratio that is from 18 to 25. And if it goes above the normal range, then there might be some problem like...
For such a small BMI, will you take 1 minute? Fatima, is it Fatima?
Yes, ma'am.
Fatima, are you going to spend 1 minute for this one line?
No.
Then keeping weight on the healthier side or keeping BMI on the healthier side is always helpful in getting pregnant and having a healthy pregnancy. Or it is for female, right? If it is a male. Keeping BMI or weight to height ratio on healthier side will always helpful in getting pregnant and having a healthier condition or healthier body, especially if he's a case of diabetic patient. Simple, make it simple, no? You have given your message without making any derogatory comment. You're getting my point?
Yes, ma'am, very clear. Yes.
Manupriya?
So, ma'am, we will say that keeping weight on the healthier side will be healthy for you and your baby and help you in getting pregnant.
Yeah, make it that way as well, sir. It's always suggested to keep BMI on the healthier side, and it helps in having pregnancy and like getting pregnant and having a healthy pregnancy.
Okay.
For that, we can put you in touch with dietitian and the physiotherapist. So you did not make any derogatory comment. You did not say that you need to lose weight, but you have given your message very smoothly, very swiftly, in a very gentle manner. There is no reason that role player is going to provoked or like feeling offended with this sentence. Will you feel offended with this sentence, Rekha?
No, ma'am. Yeah, you're right. Yeah.
Manupriya, will you feel offended this way if I say,
No,
oh,
no.
what the shit you have done? Or if I say, Manupriya, you would have done it in a better way. You have done nice, but you could have done in a better way. Which one is better statement?
Yeah, you could have done in a better way.
Yes, so you have to choose your words wisely and
Yes.
start doing it right away in your day-to-day life. It will improve your relations, it will improve your communication, and it will improve your patient retention. Even I'm sure that most of you must be practicing, right? So it will improve your patient retention. Clear?
Dr. Pooja, should we mention about the normal BMI also, or just we say
No,
that?
no. If he or she ask,
Okay, then we have to comment.
only then,
Okay.
only then. Clear, Manupriya?
Yes, ma'am. Yes, ma'am.
Tontri, Aliza, Aisha, Amna, Anam, Catherine, Manikam, Fatima, Meda, Rekha, Roshna, Sonia, and all the girls.
Yes, ma'am, clear.
Clear? Now the third. Patient with like not able to have intercourse, eventually it is a case of vaginismus or this thing, vaginal septum. So how you are going to address this problem of not able to have sexual activity in HOPI?
Vaginismus HOPI, ma'am.
It can be vaginismus, it can be vaginal septum, because that is again ambiguity. Few students say that it is a case of vaginismus with infertility. Few says that primary vaginismus can come as like they are not able to have intercourse, that's the problem, or they are not able to conceive because she has this problem, or that could be hidden agenda of vaginal septum. Whatever.
Dr. Pooja, one question I would like to ask. One of the mentor is saying that the having the this same scenario, we are unable to insert the ultrasound probe. So she was saying that how the septum could be the diagnosis here. She's always having the regular periods, no pain. So how the septum will be the diagnosis here?
Who is going to answer this question? What if somebody is having septum and having normal periods? Who is going to answer this question?
Ma'am, yes,
Yes.
I can do this. So in that tissue, there are the tiny holes which can allow the blood to flow
Very good.
from the womb to the
First
outside.
answer. Very good, very good. And what could be the second scenario?
It can be partial or it can be complete. Sometimes it can be partial.
What is the third scenario? Kind of septums are there? Like what is the classification of vaginal septum?
So ma'am, upper, middle and lower.
And
Upper, middle, and lower.
And longitudinal.
And
Transverse.
yes. Yes. It's not always that it is going to be across the wall vertical.
Yes,
It can be upper and the lower vagina. It can be right and left vagina. It can be front and back vagina. Right, Rekha?
Yes, ma'am, I got your point.
It's not always that vertical closing like fibrous tissue across the wall. It can be transverse as well, dividing in upper and lower. In that case, she would be having normal periods.
I get your point, ma'am.
Yeah. It's only when it is front and back. Even then, she is going to have normal period, because these are fibrous septa, fibrous partition, which has nude pores.
Yes.
Only if these kind of patients are going to have prolonged painful periods.
Okay, ma'am.
Because they are not going to have free flow. So it is going to be prolonged. And definitely so it will be painful as well, because there is collection of blood which is not coming out in a flow. So when there is collection, when there is hematometra, there is always painful uterus, no? Pin drop.
Yes, ma'am. Yes, ma'am. Thank you.
Okay, so I'm clear about this. So now
Yes.
the main question, what all questions you are going to ask everyone, fast. Everyone.
For vaginal survey, we have to type, right, ma'am?
Whatever you feel it is more comfortable.
Whatever you.
Or I would suggest, if you can write, I give you 1 minute, everyone, please write. So at least everyone would be able to respond that. Right, everyone. This is very important question. How to handle this situation? Yes, Roshna. Using tampon is one of the most important question. One of the most important questions regarding this. No, this is done, Fatima. I'm just asking what are the important questions pertaining to this vaginismus or vaginal septum problem you are going to ask. Okay, okay, okay. So this is okay. Everyone, are you typing? Pain around menstruation. Okay. Okay, Fatima. Manupriya, Rekha, Usha, Dr. Jaya, Samina, please write everyone who has raised the hand. Any difficulty in having sex? Perfect. That's a perfect question. The very first question. Does intercourse complete? Yes. Any scan done before? Yes. Can you tell me more about the pain at start or deep inside? Yes, Rekha. This is the very first question we should ask. Do you have any pap smear, any pain or difficulty? Arousal, dryness? Lovely. Any difficulty regarding intercourse? Yes. Enjoy the foreplay. Very important question. Yes, we will rule out sexual abuse. Roshna, speculum. Yeah, or you can simply say pap smear. You tried tampons. Yes. Manupriya, you're not typing anything. Sania, do you have any psychological issue? This is a very derogatory question. Sania? Rekha, discharge, chronic illness. How's your relationship with your partner? Very good, Fatima. Have you talked to your partner? Yeah, that's fine. Any sexual abuse? Yes. Yes, Tavinda, we will definitely rule out sexual abuse.
Ma'am,
Yes.
sorry to interrupt you. Like, definitely we are going to rule out, but what is a one-liner that we should ask?
For abuse.
Yeah.
I'll just guide for that. Let everybody complete this. Penetration
Oh,
happens. Perfect question. First time intercourse. Lovely. Okay. So now, the very first question would be, did you ever have any penetrated intercourse? Second question, if she says no, then do you find difficulty in the beginning or when penis is deep inside? Second question. Third question, do you enjoy your foreplay? Fourth question, do you have any certain beliefs about having intercourse? Fifth question, any cut given down below in your childhood? Ruling out what?
FGM.
FGM.
Yes, yes. Further, how you are going to rule out abuse? In our clinical practice, we have experienced that someone who has gone through any kind of sexual, physical, or mental abuse at any part of their life may have this problem. Would you like to share something like this?
Mhm.
This is how
Confidentiality.
you are. We can't say that you have sexual abuse in your childhood. If somebody will ask this question to me, I'll run away from clinic.
Ma'am, also we will ensure the confidentiality when we are talking about the
This is
sexual
this
Ma'am,
abuse.
please,
is
please
this
repeat.
is
I just want to write this question.
Okay, okay, some of you will repeat this. Okay, now confidentiality and sign posting for sexual course. This is intrusive question. That's why we do in the
Yes.
beginning itself. We are
Okay.
not
Okay.
supposed to do it again and again. I'll repeat,
Okay.
Amna. I'll repeat, Amna. Manupriya will repeat this for us. And then, have you ever used tampons? Are you up to date with your cervical screening? These are the certain questions which you are going to ask. If she says that I'm okay in the beginning, I don't know, after reaching to a certain point, I feel a kind of something obstructing and that becomes painful. So that is can be a sign of vaginal septum. And here you are going to rule out PID or any sexually shared infection. So how you are going to ask if she is currently having any problem, any pain in tummy with foul smelling discharge. These are the all questions which are you are going to ask. Manupriya, unmute yourself. Manupriya. Fatima, Sontri,
Yes, ma'am.
yeah, Manupriya. So how you are going to rule out abuse? Manupriya, don't disappoint me there. Manupriya, it was Manupriya only, no?
Ma'am, may I tell?
Who is this Fatima?
Rekha.
Rekha, you will be my, like, savior. You are my savior. But before that, I really want Manupriya. Manupriya? Manupriya, I'll keep asking your name unless you reply. Until you reply. God. Shit. Manupriya. This is not done. Okay, Rekha, go ahead.
In our clinical practice, we see the patients who is having this long-term pain, undergone the difficult experience in their life, like sexual abuse. And have you gone through such type of
Any kind of
experience?
sexual, mental, and physical, all.
Yes, yeah.
Do you want to share something like that? Never say that. Do you have something like this? Again, that is derogatory.
Do you want to share? Okay.
Am I clear, Amna? Amna,
Yes, ma'am.
you asked this question, right? So now you
Me
repeat.
asked.
Who asked this question?
Me, Fatma.
Achha, okay, here Amna also asked this question. Please repeat, ma'am, question for sexual abuse. Amna? Amna? Okay, Fatima, you repeat.
In our clinical practice, it seems that some women having such type of the pain might experience a physical, mental, or sexual abuse in their childhood. Do you
No
want?
childhood. This can happen at, sorry, I'm eating something. Wait,
Okay,
wait. Not in childhood. At any
okay,
point of their life, no?
okay. At any point.
Yeah. Yeah, go ahead.
Do you want? Do you have any such experience to share with me?
Do you want to share something like this? Be
Okay,
very wise in choosing your words. I'm saying that again and again. Okay?
okay, ma'am.
Now repeat everyone this. Unmute yourself and repeat. This is very important question because this is something which you are going to ask in chronic pelvic pain as well.
Yes, ma'am.
Right? This is you are going to ask primary vaginismus, secondary vaginismus, vaginal septum. It is going to be very important part of many of the tasks. So start, unmute yourself one by one and everybody please repeat this.
Ma'am, in our clinical practice, we have seen so many patients who ever in their life sexually, mentally, or physically abused. Do you feel anything like this?
Do you want to share?
Do you like to share anything like this?
Next. Next. Next, who wants to?
In our clinical practice, we can see that patients suffering from sexual, physical, and psychological abuse have such problem. Do you want to share something like this?
Lovely. Next. One more volunteer at least. So nobody will forget this.
In our clinical practice, some women have the difficult experience of physical, sexual, and mental abuse. Do you want to share something like this?
Lovely. Even Avna has written this nicely. So, are you clear about this? Now, a patient has come with anabolic steroid azoospermia, and he says that my colleagues are also taking this medicine. My gym fellow trainer is also using this medicine, but he has 3 children. So, how you can say that this is the problem I'm having this kind of semen report? How you are going to address this? I give you 30 seconds and then you one by one you are going. If you want to write, that's fine. If you want to speak up, that is better. Am I clear about my question? Am I clear about my question?
Yes, ma'am.
Okay. Okay, Rekha wants me to repeat. Azoospermia, anabolic steroid, gym trainer, he's complaining that how you can say that taking this steroid is responsible for this condition, because my fellow trainer is also taking this and he has 3 children. Okay, now start. One by one, everyone.
Ma'am, can I try?
Yeah, sure.
Mr. James, I understand your
Is
concern.
it Manupriya?
No, ma'am, Fatma.
Fatima. Okay, I'm not able to see name. Okay, Fatima, yeah.
Mr. James, I understand your concern. However, I want to tell you that these medicines might affect the release of hormones from the brain, and these hormones are
No,
responsible.
but my colleague is taking this. So how you can say this thing? He has 3 children.
Okay. So, ma'am, what?
That's the question, no? How to reply this? That's the question.
Yeah.
Yeah. Anybody else?
Can I do it, doctor? Can I try?
Sure.
Yeah, so I will understand that, but each person has different response
Lovely.
to the
Lovely.
medication.
Lovely. 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 Continue, please. I'm so happy, but continue.
Okay, so
Mm.
for us, we want to check if this related to the testosterone injection or whether medications you have. So we'll we'll ask you to stop these medications and we'll check your
That's
semen
it.
analysis
That's it.
within.
That's it. 60% you are correct. Ending should
Thank
be
you.
different. What should be
Yeah,
ending?
okay.
Who wants to try
And
this?
then, yeah, he will stop the medications and then we'll
No,
check him again.
no. You are only replying the question. My fellow trainers are also using this, so how they have children. The first line is absolutely perfect, that everybody had different kind of response for all the drugs or medication. This was absolutely perfect. What should be your second question? Second line.
It may be difficult to ask him about the age of child of his colleague. This is difficult, I think, question.
No,
Yeah.
not supposed to ask.
The rest, I don't know.
Oh no, you tried it and you are almost 60% correct. Anybody else? This is the last question of this session. So please.
Well, we can say that we don't know his perspective, but it could be the one of the reason.
More or less close, more or less very close, more refined.
चाय ले लो भाई
चाय मुझे भी दे दो चाय. Anybody else wants to try? Okay. The first line was absolutely perfect. Yes, Amna, that is also a good reply. We exactly don't know what they were taking. Correct. So first question would be, everybody or everybody has a different response to different drugs and medication. First thing. And second, yes, you can add this. We exactly don't know what they were taking. Or you can say, we don't know what exactly they have done for pregnancy. What if they have taken any treatment, Rekha? How would we know that?
Yes, we don't know. That's why ma'am, I mentioned that we don't know his perspective.
Yeah. So how you're going to say that there's different reaction to
Mm.
everybody? Everybody is not going to have same reaction, or body is going to react in a different
Mm.
way. First thing, and second,
Mm.
and we exactly don't know what he was taking, what he has all done for getting pregnant. So it's difficult for me to comment on him. But as far as
Mm.
taking steroid can be one of the reason of this kind of semen. Again,
Okay,
you
so before
will not
this
say,
line, we have
again,
to
you will
say
not
these two
say,
lines.
again, you
Okay.
will not say that this is the only reason. Probably he
Mm.
stopped taking semen, steroid,
Mm.
is still after a year, if his semen is not up to the mark,
Mm.
then if it's still he's having azoospermia, then how will you
Mm.
accept your own statement? Then you have to
Mm.
contradict your own statement, because in anabolic steroid, you do say this thing. It may take sometime three to 6 months, sometime in a year after stopping steroid to get the normal semen. Even after a year, if there is no sperm in the semen, then you will be seen by the male fertility doctor. It means you are leaving that scope. That spite of stopping steroid, there could be certain scenario where you won't be able to form sperm. This is how you address anabolic steroid, second part of the task, no? That we are going to repeat. It may take 3 to 6 months, sometime a year to come to testes to produce sperm after stopping steroid. But even after a year, there is no sperm, then you are going to, you will be seen by the expert team, including my male fertility doctors. He may ask for certain tests, blood tests, some hormonal tests, and the scan as well. We may offer you, in that case, the biopsy or tissue templing of your testes, if there is any kind of sperm there or not. On the basis of that, we may offer you ICSI, or at times you may need to go for donor sperm as well. Simple. Clear? Everyone clear?
Yes, ma'am.
Yes, ma'am.
Okay. So fatafat, fast, you just 2-3 volunteers, just repeat this statement, then we are going to wind up. We'll discuss
Okay.
about the second part of the task, that how we are going to take care of all the management part of subfertility, different scenario. We are going to do that same way, probably on Thursday itself.
Okay, ma'am.
Thank you, ma'am.
So come
Okay,
on,
ma'am.
fast, finish.
Yes, ma'am.
Hmm.
I understand your concern, Mr. James. We don't know. We do not know. Actually, everyone body respond differently for medicines and the treatment. Right now, we do not know what treatment they have taken so far for the pregnancy, because we don't
Do
know
not
their
say
situation.
treatment. You are not sure.
What they have done for the pregnancy, because
Yes.
we do not know their situation.
Yes.
Yeah. But taking steroids could be one of cause.
The reason. Perfect.
But
Perfect.
couldn't, yeah.
Perfect. Very good. Next volunteer.
Ma'am, may I do?
Yeah.
Okay. At this point, we don't know that what type of the medication and the treatment he has taken to get pregnant. Oh, sorry, for the pregnancy. But it could be the one of the reason of not getting pregnant. Sorry.
Not having sperm and semen.
Okay, that could.
Anybody else? One more volunteer at least. Then I'm going to wind up. So what I've decided, girls, Rekha, Amna, whoever is like quite active, that rather than posting task and
Yes, ma'am. This will be better way, I think.
because everyone, like all the free groups, all the mentors in their free groups are doing that. So I'm not going to do that. What I've decided, like every week, I'm going to do this way only, that 2 sessions one for information gathering, one for second part of the task, module wise. So at least you all will get some idea that how to, like, you will get idea for all the tasks, you know.
Yes, ma'am. Yes, ma'am. Yeah,
Even
this will be good way.
rather than giving like a task every day and giving feedback, because this is so very common. Everybody is doing same question, same books, same repeating,
And
same.
this is much better
Ma'am,
than we
this is
talk to you
this is
and then we makes a
yeah
correction at the same
yeah
time.
this is really helpful, ma'am. Please do this.
I'll continue this way only because
Yeah.
now it's Jan, Feb, March, April. We have 4 months, right? So
Yeah.
4 months, even I can do like two, like even I can cover 2 or 3 module in 1 month. So we would be able to cover at least 8, 9 modules in like next 3, 4 months.
Yes, ma'am. Inshallah. Dr. Pooja, can you add me your group? Actually, I'm not in your group.
You're not in my group. So
No, ma'am.
okay, so I'm just, how can I send my like link here? I don't know how to send link here.
Ma'am, you can
Fatima,
send me
you are
on
not in
WhatsApp.
this group.
Yeah, you have my WhatsApp number.
I have
I'm in your labor board
Achha,
already.
okay. Or I am just sending my Rekha. You just send my number here. I'm just like telling it 989.
I will send the link here, ma'am, in your in this message, na?
You do that. Do that. Okay. I'm not very good in technology. I'm so sorry. Usha, Rekha has already sent the link, so you can join through this link.
Okay, ma'am. Ma'am, where she is sending?
I think she has already sent in message. I can see that.
In the chat?
Yeah, in the chat.
Okay.
Rekha, have you sent it for everyone? Because there are two options, sending to me or sending to everyone. Usha, Fatima, you can see.
Yes, ma'am. Yes, I can see.
Yeah.
This is saying
Yes, ma'am.
this said the invite link is invalid or has expired. Whenever I'm trying to join, this is
Okay, what you do, just note down my number.
Ma'am, I
No,
have your
Dr.
number.
Pooja, then in that situation, you have to add her number. Then she will join.
Oh no, so what she can do, just add my number in your Telegram contract and just send contact, and send me hi on my this personal Telegram. So I'll add you.
Okay, ma'am.
Maybe, ma'am, one time this happened to me, and then you will add her personal contact number in your group. Then she will able to join your group.
So
I think.
that is also
Ma'am,
fine, girls. Usha,
ma'am, I send you message. I send you message.
you sent me message. Usha, are you able to send me message?
Ma'am, I don't know your number, ma'am, but I would like to send it.
Okay, note down my number. It's 91. This is for India.
One minute, ma'am. Yes, ma'am.
91.
Okay.
Then 989.
91.
91 is for India, right?
Yes.
Yeah, then 989.
989.
196.
196.
1320.
1320. Okay, ma'am.
See,
Thank you.
it's 91. Then 989. 196. 1320.
20. Okay, ma'am. Thank you.
If you just DM me, I'll add you.
Okay.
Yeah, ma'am, I sent, but still you didn't receive because it's showing one tick.
Okay, because I am on live session, no?
Okay.
I'll do that once I finish it.
Okay. Thank you.
Okay, so everyone take good care of you and please do not wait for booking, right? Because most of you will be able to book and booking is going to happen in Feb end. By then 2 months will be over already, right? So do not wait that once we'll book, then we'll start study. So it will never happen or it's not going to help you. Start studying today itself. Studying is never going to be wasted. Even if you don't get any kind of like booking or something or any seat, it is going to help you in November. So do not delay starting studying. That is only an excuse. Okay?
Yes, ma'am.
Okay, bye-bye. Take good care of
Bye.
you.
Take care, ma'am.
Thank you.
Thank you.
ma'am.
Thank you,
Thank you,
ma'am.
ma'am.
And I hope you like the session.
Thank you, ma'am.
Always welcome.
Thank you, ma'am.
Okay, thank you. And give your feedback in free group. That keeps me motivating.
Yes, ma'am.
Okay, thank you. Bye-bye. Take good care of you.
Thank you. Bye, ma'am.
Ma'am, please add me in free group.
Who is this?
Ma'am, Dr. Kavinda.
Kavinda, did you message me? Do you have my number?
Yeah, ma'am. Yeah, ma'am.
Okay. Okay, I'll do that. No worries. I'll definitely do that.